The second pillar for the discussion will be health service delivery. That is plenary number 2. So when we talk about health service delivery, we need to ask ourselves, what are the healthcare services that we need in our respective communities as young people? So if we need healthcare services in our communities, then we need to know that these services meet our needs. And they have to be responsive to our needs. They have to be offered in a way that is respectful of our rights as individuals, so our social and individual preferences at that particular context. So when we talk about health service delivery, then we need to be asking ourselves as young people, do we have youth responsive services? And beyond youth responsive services, do we have the youth services first of all? Do we have the services that are addressing our healthcare needs? Are they responsive to our needs as young people? And once we understand that, then we need to go beyond that by asking ourselves, we will not remain young forever. Therefore, the services that we need today might not be the same services we'll need 5 years from now, and will not be the same services we need 100 years from now. And on that account, then we need to ensure that the service matrix and the service portfolio that is what is available meets that standard. And then the next thing in terms of responsiveness, I hear most of the conversations that we've been having have been around having people who understand our needs, our interests, and also engage with that as a personal level that they, from a point of understanding. But beyond that, we also have to ask ourselves, are we making these acceptable and actually applicable across generations, across genders? Because unless we make it cross intergenerational and cross-cutting, then it will be biased, and we need to ensure that level of justice and fairness in terms of service delivery, and these services need to be offered to the people who need them. The next thing we need to look at is health service delivery from a perspective of young people as healthcare service providers. We have most of our young people who are healthcare service providers. Medical students are graduating, pharmacy, nursing, all the healthcare students that are coming in, including community health workers. Are they equipped to be able to deliver quality services? Because health service delivery is pegged on the availability of quality healthcare services offered by proficient and qualified individuals. So if that is not met, then we are missing the point. And our urge is to ensure that from ensuring the services are what they need to be, the people who are offering them are empowered, engaged, and motivated to be able to continue doing that and offering those services. And on that account, then we need to ask ourselves, how does it come to a place where we have a resourceful and actually well-equipped, competent workforce to deliver healthcare services? So healthcare service delivery as a plenary session will be focusing on youth as service providers, but at the same time as consumers and influencers of healthcare service delivery. As a young person, what role do you want to play in that matrix? If you feel there's something you want to do, come join us for the Youth Voices Summit, 1st to 3rd of December, Amref International University. Let's engage, let's shape the future together, and I believe you'll be able to shape that future with us. Thank you, and engage with us.